Hey, Bobby, I have a question. So tell me, what's the water situation like? And getting clean water and I think of that as a big potential public health issue. I mean, we're now seeing here in Arizona with COVID up at the Navajo Nation that like
Yes.
less than 50% of the homes have good running water that's drinkable. So
Right.
can you just talk about that from the perspective of what you saw there?
Yeah, and that's a real problem in Africa. There, where we're at in Uganda and Jinja primarily, it is the source of the Nile. Believe it or not, it is the source of the Nile River, and they cannot drink the water. So they have to buy their water or they have to sterilize it themselves, which is crazy. So, people say all the time, well, I want to help, but I'm not going to Africa. Great. Sponsor the hospital's water delivery for a month. There are things like that people can help with. They do get water delivered. Electricity is hit or miss at the hospital. I went 3 days. I was just there in March, just last month, right before the COVID hit. We actually came back during the crisis. For 3 days, we didn't have water at the hospital. We occasionally, we do have a generator, thankfully, for the electricity. But those resources, again, you compare our underdeveloped and underserved populations in the United States, which all of you just visited with a community survey. And you say, what are solutions to bad water, to no water, to what are they? Well, would we think of some type of water delivery service that could give them at a discount, that could provide it in a public place, that could be, what kind of solutions can we come up with in our public health sectors, especially those underserved populations? Thanks, Ann, that was a good question. Because resources, and that's part of your learning outcomes too, is resource allocation. I'm using all free technology to serve 100 employees at a hospital across the globe, and it doesn't cost me a penny, and I can do it from my living room.
What Bobby is talking about actually reminds me of a couple of things. First, what did I tell you, like the first day of community? To be a community health nurse, you have to be 3 different things. You have to be compassionate, you have to be creative, and you got to be fun. You got to find the fun in it, right? But that creativity is such a huge part of being a community health nurse. And I think back to just even the story I've shared with a lot of you about the guy I worked with in home health where I was hanging Vanco. There was no IV pole when I got there. So I had to get creative, and I used his curtain rod. It was right beside his bed. Why not? So I hung the IV bag on the curtain rod. So you've got to be able to find that creativity. And in light of what Bobby said about always being invited, I know you've all heard me say this numerous times. Don't you dare trample on their playground. The minute you do that, you're not going to be welcome back to play. Right. So make sure that you are invited. So right. I'll turn it back to you, Bobby.
Sure. So back to the resources and where do you find them? I started in the sectors of healthcare. I went to the Ministry of Health and the colleges and the nursing representation of those people. But what I've learned is there's an organization called SONCIEL. It's an organization of scientists who are nurses, entrepreneurs, innovators, and leaders. And they do hackathons. They invite new nurses to share their innovation, and they give away prizes, and they connect you with resources outside of the health sector. And they are partners with Johnson & Johnson. Sometimes if you just do a really broad search I would be kind of curious to see what resources for nurses look like right now. I bet that it will show up just PPE. That's all you're going to find right now in any search resources for nurses. So I'm thinking as far as resources go, what do you need to do your job better? For example, I'm searching for financial support to build this technology I know I can build. It's integrating these technologies into one system. So who do I need? What resources do I have to find? I have to find a coder who can build these things. the standard community resources are, where do you get, the American Heart or the Red Cross, or where do I have homeless shelters or domestic violence shelters? Those are all resources. But I beg you to think further. Think in businesses. How can, there was a nurse profiled recently who is an ICU nurse, but saw a need for the homeless people weren't getting care, and she realized everybody was donating food to nurses, and she just rerouted all of the food that was donated to the nurses to the homeless. That's a kind of cool workaround. You betcha.
Hey, Bobby, Ruby has a question of how do you help the Navajo Nation?
I just wrote a grant to try and help the Navajo Nation. That's so funny that you asked that, Farah and Ruby. Thank you. There's so many governmental barriers, to be honest with you, that we need to overcome to be able to help them better. And that's something that I'm really committed to as well, because I have my own experience and evidence that if you eliminate those types of bureaucratic barriers, that you can have impact. I was in New Zealand last year and met with the Maori tribe, who very much had the same thing happen to them, where their land was taken from them, and it was just awful. Well, in the last 30 years, they've been given all their land back, but they also have been given back business, education, and they're making money for the Maori people, and they're self-sustainable. So those are solutions we need to look for the Navajo Nation, are sustainable solutions by the Navajo Nation with the support of these agencies, resources, willing to commit those resources to get themselves self-sustainable. The real answer to any underserved population is to lift them up, meet them first of all where they are, but lift them up to where they can manage and coordinate the health of their communities. So, people say, well, you're going to Africa and you're doing all of this at Whispers, but Whispers is becoming the center of excellence, and Whispers will use the technology that I gave them to serve 8 clinics we're opening all across the region in Uganda this summer, provided COVID lets us travel. So we are creating a sustainability model for them. I step right out. I've built them the tools, the resources, the platform, and we don't get paid. I don't want you guys to think this is a business. We do this to do this. We don't get paid, and it's just really to do what we do. So that's kind of how they're going to sustain it, is they'll use this technology and they will be able to serve these 8 out far regions for kids to get those services, but with the idea of health promotion and wellness, so that we can educate the community. So you're not just doing tertiary care. It's not a episodic emergency basis. That's not a winning solution. We've lived in tertiary healthcare forever. It's the wrong place now. We all know that. Thank you, COVID. You can thank it for a lot of things, but that's primarily one of the big paradigm shifts that I believe we're going to see come out of this, is how do we take care of people where they are efficiently, effectively, safely, but with their involvement so they can sustain themselves healthy. Does that make sense?
Yes, I have a question.
Yes.
My question is, I am Navajo. I am from the Navajo Nation. And I was listening to you talk. It's really interesting on how you present it, but I think it's different on the Navajo reservation for the fact that you talk about having businesses involved. The town of Fort Defiance is near the Window Rock, the Navajo Nation itself. There's not a lot of business there. There's only like maybe a 7-Eleven and a gas station. And then that's a burger. So then you drive, I'm going to say like another 15 minutes to get to Abash's, and then you get one more gas station. So how do you incorporate them to come to an understanding that the community needs help? It's all about communication, and I've learned that as I have lived off the reservation. As I'm going to school, I'm learning more about it. So now with all the COVID going on, it's been hard Because
No
like right
kidding.
now we have my mom here. She's not back home on the reservation. She's here with us in Phoenix. So
Good.
that's a plus. But it seems like all we Americans do is we just talk about it. We don't apply it on how we can help.
One of the ways, Ruby, that I think that is the first and most important approach is going to be as a member of that community, going to a community when we can, right? When we can all get in a group of more than 10, or even do it in a virtual capacity, however, but I'm thinking the most important thing is to really have everyone vision, what does their community look like? What do they want it to look like? What kind of businesses do you want here? What does your schools look like? What does the farming look like? Is the land okay for that? What capacity do we have? The people have to see their capacity first. They have to find their voice. And then people like you who have stepped out and got educated and understand the cultural situation can bring resources and network people. Really, it's networking. And, you know, it takes someone, though, on the inside, because I will connect with you, because when I get this grant, I need a representative of the Navajo Nation to partner with. So there you have it. We can do it together.
That's what I want to hear. Let's do that.
So, and Ruby, I just want to share with you. So you mentioned Bashes. So Bashes actually just donated 2 truckloads, and I cannot tell you the amount of money. I know it was well over $25,000 in groceries for the first 2 trucks, semi trucks that went, and then they sent up 2 more trucks. And the only reason I know about this was Bashes reached out to local churches to see if they would be willing to pack these groceries into boxes for all of the different families.
I don't see a lot of people offering like a lot of help to the Navajo Nation.
It starts at the grassroots. I mean, the most successful community, and you know, that's what we're talking about, really. The most successful community outcomes occur in a situation where you've got huge buy-in from community members with a clear vision where they're going to go. And it's usually going to be that grassroots. It's not going to be the businessman that comes in and says, you just need X amount of businesses and this XYZ here and you'll be fine. No, you don't, because it may not even match the passion of the community at all. And it was nothing like that they needed. But so it really has to just start somewhere. And that's the thing that I want to impress upon all of you. It's just not being afraid to innovate, to seek out those supports, and to ask people to start something. You can't really wait for other people to do anything.